Vancouver, drove to visit my son. And when we got back home, I became very concerned about my husband. He didn't seem to be quite himself. So we went to the doctor. The doctor sent us to a specialist, and Lloyd was diagnosed with a cancerous brain tumor. I was still recovering from the shock, and the CCAC people were just perfect. And they didn't ask me to drive over to their office to talk to them. They would come here, which was very important because it kept Lloyd in the loop. He knew what was going on too. But in order to have him to be able to stay at home, we contacted the CCAC, and we had a lady who came. She was great. She got to know us. She would do everything for us. We got to know her and her family, and it was marvelous. She was such a caregiver. They were caring to come to the house. Always, at anything I needed. All I had to do was call, and I would have help. I don't think we could have managed without. I couldn't have. There's no way.
The most important formula for success for community care is understanding the client needs and working with the client to develop a care and treatment plan that allows them to be their best in everything that they do. We're in the healthcare business, and there is much information available to us about evidence-based care and good quality care. So you overlay that on top of what the client's wishes and desires are for themselves. So you're really working hand in glove with the client and their family to determine what treatment options are best. The most important thing is to be sure that we're delivering safe care in an environment that's hospitable to recovery and the maintenance of independence. So we really want to understand how we best can work with our clients and families to optimize their functioning.
It's very obvious from the board's point of view that the staff and the CEO work very hard at developing relationships with our service providers. We're willing to go out to all community agencies to ask them or be involved with them in terms of the healthcare environment. What should be done? What can be done? What would you be willing to help us with? We have something to do, and our something as a board member is to provide guidance and leadership to the CEO in terms of healthcare from a community point of view.
So, as many individuals as there is that many individualized care plans to be developed. We can't operate under a cookie-cutter approach because of the many variables that we have. So each care plan really needs to be tailored very specifically for both the client as well as the family. Collaborating with our community partners and making those relationships so that we're able to maintain them into the future to benefit all of our clients is really important to us, and something that really the client benefits in the long run. So CCAC can provide some service, but if we can maximize the services available by partnering with others in our community, it's the client and the family who win in the end. Quality is something that we take very seriously at CCAC. It is something that, regardless of the number of people we ask about it, they're all going to have their own definition. For me, it means being able to meet the client needs in the best way that we possibly can so that they have the outcome that they are looking for.
Healthcare is very complex, and it's important to keep looking at how you can improve the way that you deliver care and how you can improve the way that your organization functions for that purpose.
quality means do the best you can with what you've got, and then a little more.
All of the CCAC people that I met were just excellent, caring. I have a friend right now who's in very bad physical condition, living in her own home. And I'm trying to convince her to get CCAC to help her, because I know what she needs, you people can do.